Diabetes is a huge problem. 828 million people worldwide with the disease, half of them untreated.
The burden of diabetes is particularly severe in low and middle income countries, where 80% of the cases are found. In India alone, over 200 million people are living with diabetes.
In the last 30 odd years, the prevalence of diabetes has increased dramatically. The odds of somebody who's 20 years of age today developing diabetes during their lifetime rises to about 75 or 80%, which is really, really excessive.
One of the biggest problems with diabetes globally is inequity. When we look at the global north and south, there are such glaring differences in the access to care, capacity to screen, and even the types of care that are available for individuals living with diabetes.
98% of diabetes research is in populations living in high-income countries. That creates a mismatch between where the burden is and where the research is happening. We want to start changing that.
Inspired by the European St. Vincent Declaration nearly 40 years ago, but now in response to global inequities in diabetes, the Novo Nordisk Foundation invited 50 of the world's leading experts in diabetes research and care to join the Global Diabetes Forum. The aim was to promote collaboration, share ideas, and discuss global challenges and solutions. The initiative led to the creation of the Copenhagen Declaration for Diabetes.
The declaration is a very bold, transformative vision for the future of diabetes prevention and care in the global setting. The idea behind the declaration is, how can we leverage better knowledge of prevention, the growing advances in precision medicine and more specific and customized management of the disease, taking advantage of artificial intelligence, diabetes technologies, new models of care, and how do we make therapeutics and diagnostics affordable?
One or two key recommendations that stood out for me from the declaration, especially in the nearer term, was looking at shared platforms in education, shared platforms in risk and tools that are existing that could be shared on global platforms that could be used around the world.
Well, the world is shrinking in many respects, right? I mean, we've stopped living in silos. Learnings from one part of the world become very relevant. Maybe they need to be adopted after modification to local context, cross-pollination of ideas across countries.
The declaration itself cannot be an end in itself. You would need other stakeholders, governments, ministries, and persons living with diabetes to complete that loop.
We believe that this offers a blueprint to start the discussion, to start a conversation.
A concerted global effort is more crucial now than ever to reduce health inequities and improve outcomes for individuals with or at risk of diabetes, regardless of their location.